Hi everyone, welcome. Today I wanted to talk to you a little bit about deviated septum. And it's a condition that affects a lot of patients. But before we can talk about deviated septum, let's talk about what the nasal septum is. So the nasal septum is the middle wall of your nose, and it goes all the way back till in the back, the right side and the left side meet. So it divides your nose into a right and a left side. And the septum is made out of cartilage and it's made out of bone. So sometimes this cartilage and bone could be crooked to one side or the other. This is what we call a deviated septum. And it's pretty normal. If you look at everyone's nose, probably 95 out of 100 will have a crooked septum. But do you need to do something about it? So that's what we want to talk about today. The 5 signs that you may have a deviated septum and you may need to do something about it. So the first thing is the obvious one. You can't breathe through your nose. Can't breathe through one side or can't breathe through the other side. That's a fairly common complaint of patients that come into the office saying, I can't breathe, I've used over-the-counter medications, it's not working, what's the problem? Sure enough, you look in there, pretty significant deviation of their septum, they need surgery. The second sign may not be as obvious, and that is frequent nosebleeds. So one of the symptoms of deviated septum is that you can get frequent nosebleeds. Why? Because as air is moving through your nose, if it touches that crooked portion of your septum, it dries it out. When it dries it out, then you're more likely to bleed from there. So frequent nosebleeds can be a sign that you have a deviated septum. Now another sign that kind of goes, with the number 1 sign is that if you're obstructed more on one side than the other. And that makes sense, right? If your wall is crooked towards the right side, your right side is going to be more obstructed. If your wall is crooked towards the left side, your left side is going to be more obstructed. So that's one of those things that if you have it, pretty sure that you have a deviated septum. The 4th sign is if you can see an obvious deviation of your nose, right? So the septum on the outside is more the midline portion of your nose. And if your midline is moved to one side or the other, or if you're looking from the base view and you can see the wall in the middle is crooked to one side or the other, that's pretty obvious. You have a deviated septum. You may need to get that fixed, right? So that's pretty obvious. And the final sign would be if you're using medications for nasal obstruction, you just keep using it and it doesn't get better. I think that's pretty good indication that you may have an anatomical obstruction. Instead of swelling from allergies, there is an obstruction based on the way that the shape of your nose is on the inside. So you need to see someone, and you need to see them so they can examine you in your nose. They'll need to use an endoscope to see all the way in the back of your nose to be able to evaluate you and see if you have a deviated septum and if you need surgery for that deviated septum.